Hi everyone, I am Dr. Srikanth Munna, consultant andrologist and urologist from V9 and Andro9 Hospitals, Begumpet. So, when does men require their sperm to be frozen? So, why freezing a sperm is an option? So, generally, with age, your sperm potential may go down, the sperm quality and quantity may go down. When you are planning for pregnancy in future, you may be having a low sperm count. So, but how often is it? How significant is it? So, generally, do we need to think about it? Do we need to freeze for that simple reason? May not be the reason, but however, if you are planning for pregnancy in future and if you want to hold for a while because of some personal reasons, if you are having a low sperm count already, which is called as oligospermia, or if you have a low sperm quality, which may be necrosospermia, teratospermia, okay, asthenospermia, where the swimmers are less in quantity, and if you are still holding your pregnancy for some reason, then it is time for you to consider about sperm freezing. Because when the time you come back to a decision that yes, I need to get pregnant now, I need kids now, your sperm quality, which was already low, may be still going down because of an ongoing damaging process. If you are not taking treatment, if you are not evaluated for that problem, the best thing for you to do is to freeze a sperm. And the second reason is patients who are undergoing therapy for cancers. Say, for example, if you are diagnosed unfortunately with some cancer, where chemotherapy and radiotherapy are as an option for you, and you are considering for it, and you are still planning for more kids in future, then you should consider about sperm freezing. Because the documentation has been clear that chemotherapy, radiotherapy will produce an oxidant injury around the testis, and the sperm producing cells will be permanently damaged, where it cannot be recovered in future even after you stop chemotherapy or radiotherapy. The next reason is age. So if you are planning pregnancy in future and if your age is crossing roughly around 40s or 50s, unfortunately, if you don't have kids or if you don't have wife, you are still planning to get pregnant or get married with a new wife or second wife because of your loss of wife or children, whatever the reason for good or bad is. If you are planning your pregnancy in future, then age related degeneration is a common problem, and India being the central capital for diabetes and hypertension, we are seeing a lot of patients post COVID with a drastic deterioration in their sperm quality after 40s. So if you are crossing 40s and if you still don't have your life plan yet about kids, it is time for you to consider for sperm freezing. And the next most important reason is gym goers. So, if you are planning on your professional lifestyle to become a gym builder, a bodybuilder, so generally what you do is you take a lot of steroid supplements for you to build, or protein supplements, or you may be having low testosterone. So, to build up more muscle bulk, you need to be taking on steroid testosterone. Testosterone is a hormone which is also a steroid. So, when you take these steroids from outside, the body from within, inside, will stop producing these natural hormones, which are nothing but essentially important for the sperm production. So, once you start this taking from exogenously from outside, the inside hormones and the sperm count will go down. Obviously, when you are planning for pregnancy, once you are Mr. Hyderabad or something, and when you go back of planning about marriage and kids, you may be having a zero count, which is a reversible problem. Once you stop all these things, may be reversed after a period of 1 year or two. But still, if you are aware of this topic, it is better for you to freeze your sperm before you start your professional career and go back to your personal life once you are succeeded in this, and then you can utilize this sperm. So the next question is, how long should I freeze this sperm, or how long could I freeze this sperm? So the sperm, there are studies where even after 10 to 15 years, the sperms are retrieved from the frozen chamber and they are utilized for getting you pregnant, and it is as good as a fresh sperm. So there is no time limit for this. Considering your IVF center or your andrology center where you are freezing stands for a good time, like a good branded one, which can stay for a long time. So once it is frozen, it is metabolically zero active. So once it is thawed, it is as good as a fresh sperm. So next question is how to use this frozen sperm. How can I use it? So say for example, if you are a military personnel, you are working at another place or another country, you are on a deputation or you are on planning at your travel, but your wife has to be here. Generally, we see a lot of international patients coming from other countries like Yemen, Syria. The wife will be staying here for IVF procedures, but the husband cannot be here because of his work, for his livelihood, where he has to feed his wife or for pay for her expenses. So similarly, our population also generally face these problems when the wife is carrying or she has to stay back in India. The husband is somewhere working in US as a software employee and cannot come back because of visa issues and all those things. So once the sperm is frozen, it can be utilized in three manners. Like the sperm can be thawed, the entire semen can be just used as an IUI within the female vagina. So it's like a natural process of ejaculation within the vagina. The sperm has to go swim and find the egg at that time. It is little slightly risky process because as we have only one sample and the female partner should release egg exactly on that day of or around that day of insemination. So it should be successful. The second process is for IVF, where we retrieve the egg from the female and take a good quality sperm under microscope. Both keep them in a test tube. They naturally penetrate and they form an embryo. The third process is ICSI. This is done when the sperm is of poor quality. Say for example, if you have poor quality sperm, the next question is, can I freeze it? Yes, of course. There are few limitations for a sperm freezing, but even if it is around 1 million with a very poor motility, still the sperm can be frozen and it can be utilized through a process called as ICSI, where we artificially hold the sperm and penetrate it into the egg, create a fertilization, make sure the embryo is formed, and then we will be utilizing that embryo to build a baby inside a mother's womb. So these are the conditions: how to freeze, when to freeze, where to freeze, how long can be frozen, how to use them back, and who are the population to be selected to freezing the sperm. So if you have any more doubts, consider contacting V9 Hospital. We have a sperm freezing facility here. We have cryopreservation here. If you are thinking about you are freezing the sperm for the above causes, please contact V9 Hospitals, Begumpet. Thank you.